Hi, I'm Tanya Cordy, and I'm a student occupational therapist, and I'm going to be talking about how occupational therapy can benefit those within the criminal justice system. So first and foremost, we need to understand really what occupational therapy is and what our role is in helping people. So occupational therapy is targeted towards really anybody who maybe is experiencing a physical limitation, an illness, a mental illness, or really just any barrier that prevents them from participating in daily activities that they need and want to do. So within the criminal justice system, we know that 2/3 of inmates that are released are often rearrested within 3 years after release. So as occupational therapy practitioners, we want to look at that and kind of think, okay, what tools can we provide and what education can we provide and skills we can help somebody with to make sure that they have everything they need to be productive members of society and to prevent them from reoffending, essentially. So with that being said, we help with independent community living, so providing resources and the tools needed that somebody would use and need to find housing in the community. And then sensory and emotional regulation, so helping people to positively cope with their emotions and really identify what they're feeling and how to prevent it from getting out of hand. Activities of daily living, so that would be anything from brushing your teeth in the morning, cooking a meal, taking care of your kids, getting dressed, all of those things. Vocational role functioning, so yes, we do help people find jobs and employment, but that's not the only thing we can do. Time use and management, so this one is really important. We can help those who have committed offenses in the past to really examine and break down their time and understand what times of the day am I most at risk for, doing something that I shouldn't be doing. Is it in the morning when I don't have to go to work yet, or when my kids go off to school? And then understanding how they can better spend that time so they're not at risk for reoffending. Social and leisure participation, so kind of similar thing, understanding what positive influences are and how to establish a new social circle and routines. And then goal setting. So this kind of is important for those who really don't have a lot of motivation or are struggling with accomplishing things that they want and need to do. We help with identifying what their goals are and helping them to be committed to following through with them and that self-discipline aspect. So really we have a wide scope of practice, and there are just so many things that we can do to benefit those within the criminal justice system. And really our goal is to help break the negative cycle of whether that's substance abuse or just crime in general, and to help facilitate healthier roles and activities. So that's a little bit about what occupational therapy is and how we can benefit those who are within the criminal justice system. So hope you learned something.